All right, we're with Dr. Deb Houry of the National Center for Injury Prevention and Control, part of the Centers for Disease Control and Prevention. You oversee the opioid epidemic, or track it. How has that changed in recent years, and how has it migrated across the country?
So what we've seen is since 1999, it's really increased to where the numbers have skyrocketed, essentially quadrupling. I believe it's 14,000 people that died in 2014 from prescription opioid. The number is actually up to 28,000 if you count any opioid. And it's diffusing across the country, but it is really concentrated in areas like Appalachia, the South, the Northeast, and Midwest are where we're seeing it most hard hit right now.
Okay. So in general, are the use rates and the death rates and overdoses, are those trend lines accelerating, slowing at all?
So we saw the use rates and overdose rates start to slow. We were quite happy to see that, like from 2011 to 2013, we were starting to see it wasn't accelerating at the level that it had been, but then in 2014 we saw it increase 14%, the biggest jump we had had. And what we're seeing is across different demographic groups, it's continuing to increase. So for different things like heroin, we're seeing it increase more in the younger ages, but if you look at overdoses and prescription opioids, it's increasing in middle-aged population. So each demographic is really impacted by this epidemic.
Okay, and we're talking about opioid abuse. Or opioid trends. Can you tell me what's the definition of an opioid and what drugs are we talking about?
So I think, we talk about both prescription opioid and illicit opioids. So prescription opioids include things like hydrocodone, or more commonly known, the trade names are Vicodin, Percocet, but can also include things like methadone, tramadol, as well as fentanyl. When we look at illicit opioids, those include things like fentanyl and or heroin. So when we talk about opioids in general, it includes all of those. Prescription opioids are the medications that people are getting from the doctor, like Vicodin.
Okay, and speaking of doctor and prescriptions, CDC recently came out with new guidelines for prescribing practices. Can you maybe summarize
Sure.
what those are?
So those guidelines are intended for primary care physicians taking care of patients with chronic pain or pain lasting more than 3 months outside of active cancer, palliative care, or end of life. And it's really just focusing on safe prescribing tenets such as non-opioid medication to be preferred line of treatment, starting with low doses if you do initiate opioids, and things like reassessing a patient at a regular interval to ensure that the opioids, if they do use them, the risks still weighing the risks and the benefits.
Okay, and as a medical community, is it responding? Is it starting to try to change its practices?
So we have done a lot of outreach with our partner organizations in medical settings, as well as groups like the American College of Preventive Medicine, American College of Emergency Physicians, and are working with them to look at both medical education modules as well as ways to integrate these guidelines in different medical settings. And I think because we've realized this is such an epidemic at this time, providers are really stepping up and working with us on this.
Okay, and finally, what's the next potential big threat or hot spot? Is it a particular drug or a particular region of the country that's experiencing some big acceleration?
So I think, unfortunately, with this epidemic, you almost don't know where the next hotspot or next epidemic will be. I think some of the things that we're seeing are injection drug use has become an issue. In Indiana, we saw the HIV outbreak in a county. Now we're seeing things like neonatal abstinence syndrome increasing in different areas, and that some of the infants are now developing hepatitis later on. So I think there's so many different aspects to it, and things like the fentanyl pills that we just have been hearing about in the past few months.
Okay, I think that's all I need. Thank you very
Great.
much.
Thank you.